1. Which organs are contained in the right upper quadrant of the abdomen? A. Spleen, tail of pancreas, stomach, left kidney, and part of the colon. B. Liver, gallbladder, head of pancreas, part of duodenum, and part of the colon. C. Appendix, ascending colon, small intestine, right ovary and fallopian tube. D. Small intestine, descending colon, left ovary and fallopian tube.
Answer: B. Explanation: this choice lists the organs that can be palpated in the right upper quadrant: liver, gallbladder, head of pancreas, part of duodenum, and part of the colon. 2. Chest pain associated with stable angina may be caused by A. A buildup of lactic acid and CO2. B. An occluded coronary artery. C. Cardiac dysrhythmias. D. Cardiac cell death.
Answer: A.
Explanation: stable angina is caused by a temporary low-flow state in the coronary arteries that does not lead to cell injury or death, infarction. During hypoperfusion, lactic acid and excessive carbon dioxide are not carried away, causing irritation and pain. 3. Your patient is a 65-year-old female complaining of chest pressure. The EKG shows a wide complex tachycardia at a rate of 200 beats per minute. The patient's vital signs are P equals 200, RR equals 26, and BP 90/60ths. Which of the following answers is the best treatment for this patient? A. Lidocaine 0.5 to 1.0 and G/kg IVP. B. Synchronized cardioversion at 100 joules. C. Defibrillation at 200 joules. D. Amiodarone 150 mg IVP, push slowly.
Answer: B.
Explanation: due to the low blood pressure, this patient would be classified as unstable. Immediate intervention will be needed to correct this condition. Delivering medications may take too long to administer. Defibrillation may invoke ventricular fibrillation. 4. What does the P of the AVPU acronym mean? A. Response to painful stimuli. B. Perception of the environment. C. Level of pain they are feeling. D. Radial pulse rate and rhythm. Answer: A. Explanation: in the AVPU acronym, used to assess the level of consciousness, the P stands for the patient's response to painful stimuli. 5. What are the components of the focused history and physical exam? A. ABC and LOC assessment and vital signs. B. Sample history and focused examination. C. Head-to-toe check and treatment of injuries. D. Vital signs and detailed physical exam. Answer: B. Explanation: the focused history and physical exam, undertaken only after immediate threats to life have been corrected, consists of ascertaining the nature of illness or injury, previous history, by a sample, vital signs, and focused exam. 6. What does pulse pressure refer to? A. Diastolic blood pressure, reading multiplied by the systolic reading. B. Systolic multiplied by the diastolic blood pressure reading. C. Difference between the systolic and diastolic readings. D. Systolic blood pressure as measured by a Doppler device.
Answer: C.
Explanation: pulse pressure refers to the difference between the diastolic and systolic blood pressure readings. A narrowing pulse pressure indicates increasing diastolic pressure and decreasing systolic pressure. Perfusion will stop once both pressures come together. 7. A 56-year-old male experienced a syncopal episode and is now complaining of intense chest pressure. His vital signs are RR equals 26, P equals 110, and BP equals 80/64ths. Crackles can be auscultated in both lower lung fields. Which of the following conditions best defines the patient's presentation? A. Congestive heart failure. B. Cardiogenic shock. C. Cardiac arrest. D. Malignant hypotension. Answer: B. Explanation: the patient's heart is not pumping efficiently, possibly due to an MI. This would result in a loss of blood pressure throughout the cardiovascular system, including the pulmonary vessels. The lack of pressure causes plasma to leak into the interstitial space of the lungs, causing the adventitious breath sounds. 8. An elderly male is complaining of a sudden onset of severe pain in his right leg. The affected extremity is cool to the touch and pale. The temperature and pulse in the patient's left leg is normal. You suspect A. Varicose arteries, B. Arterial occlusion, C. Pulmonary embolism, D. Deep vein thrombosis. Answer B. Explanation: a sudden loss of blood flow to the leg within the arterial bed would account for the sudden change in skin color and temperature. Answer questions 9 to 11 on the basis of the following information. You arrive at a golf course to find a 45-year-old male unconscious and responsive to pain, but only with movement. The patient was struck in the head by a golf ball traveling at high velocity. His eyes are closed. Pupil examination reveals his left pupil is 2 millimeters and the right is 8 millimeters and not reactive to light. This patient moves upper extremities to localized pain and moves lower extremities spontaneously. He is breathing full deep respirations at a rate of 24 per minute. 9. You arrive at a golf course to find a 45-year-old male unconscious and responsive to pain, but only with movement. The patient was struck in the head by a golf ball traveling at high velocity. His eyes are closed. Pupil examination reveals his left pupil is 2 millimeters and the right is 8 millimeters and not reactive to light. This patient moves upper extremities to localized pain and moves lower extremities spontaneously. He is breathing full deep respirations at a rate of 24 per minute. You would expect the vital signs of this patient generally to follow which of the following groupings? A. RR increased, HR decreased, BP decreased. B. RR increased, HR decreased, BP increased. C. RR decreased, HR decreased, BP decreased. D. RR decreased, HR increased, BP increased.
Answer B.
Explanation: this set of vitals, known as Cushing's triad, respiratory rate increased, heart rate decreased, blood pressure increased, is common in closed head injuries. 10. Treatment of this patient would include which of the following? A. Spinal immobilization to a long board with cervical collar. B. 4 fluid boluses titrated to a systolic BP of 100 to 110 millimeters of mercury. C. Opening the patient's airway using the head tilt/chin lift technique. D. Placing the patient in the sniffing position to facilitate airflow. Answer D. Explanation: placing the victim in the sniffing position manipulates the head and neck, facilitating airflow. 11. A patient with a closed head injury should be closely monitored for all of the following except A. Hypovolemic shock, B. Respiratory alkalosis, C. Hypoxic seizures, D. Hemopneumothorax. Answer D. Explanation: choices A, B, and C are all common in closed head injuries. Choice D, hemopneumothorax, is not. 12. Your patient, a car accident victim, complains of seeing a dark curtains in front of one eye. What should you suspect? A. Optic nerve damage, B. Retinal detachment, C. Orbital fracture, D. Conjunctival hemorrhage. Answer B. Explanation: a patient with a detached retina will often complain of seeing a dark curtain in front of part of the field of vision. 13. Treatment for a patient in cardiogenic shock who is complaining of chest pressure should include A. Adenosine 4-push, B. Furosemide 4-push, C. Dopamine infusion, D. Nitroglycerin SL. Answer C. Explanation: although the patient may be complaining of chest discomfort, administering nitroglycerin would only worsen an already low blood pressure. Even with fluid leaking into the interstitial lung tissue secondary to the low blood pressure in the pulmonary circulation, a diuretic would also carry the same risk of reducing pressure even more. This patient requires a vasoactive medication such as dopamine to increase blood pressure. 14. Signs and symptoms of traumatic asphyxia include which of the following? A. Paradoxical chest motion, pain on inspiration, and increased respiratory rate. B. Dyspnea, bloodshot eyes, distended neck veins, and a cyanotic upper body. C. Agitation, air hunger, distended neck veins, shock, and tracheal displacement. D. Shock, cyanosis, absent breath, sounds over one lobe, and flat neck veins. Answer B. Explanation: traumatic asphyxia occurs when serious rib injury pushes the chest wall inward, resulting in severe hypoventilation and backflow of venous blood. Important signs and symptoms of this include dyspnea, bloodshot eyes, distended neck veins, and a cyanotic upper body. 15. An adult patient has burns covering her head and upper back. Using the rule of nines, this patient's burns cover what percentage of her body surface area? A. 9%. B. 18%. C. 27%. D. 36%.
Answer: B.
Explanation: the head and upper back are each equal to 9% of body surface area. 16. How would you classify a burn that is pully white and almost painless? A. First-degree burn. B. Second-degree burn. C. Third-degree burn. D. Chemical burn.
Answer: C.
Explanation: this is often the appearance of a third-degree burn, which is painless because of destruction of nerve cells. 17. Which of the following conditions indicates the need for rapid transport? A. Isolated penetrating trauma by a knife in the upper forearm. B. A pedestrian struck by a motor vehicle traveling about 10 miles per hour. C. First-degree and second-degree burns to the anterior chest. D. A pulse rate, 130, blood pressure, 90/60, and respiratory rate, 36/min.
Answer: D.
Explanation: the vital signs listed in choice D indicate the presence of shock. An isolated injury of penetrating trauma to the upper arm is not generally life-threatening. A 10-mile-per-hour impact to a pedestrian is not generally a significant MOI. Burns to the entire chest cover a body surface area of approximately 9%. This would not in itself require rapid transport unless other problems existed. 18. What is the Glasgow Coma Scale score for a patient who opens her eyes in response to pain, speaks incomprehensibly, and withdraws in response to pain?
A. 6.
B. 7.
C. 8. D. 9. Answer: C.
Explanation: eye opening equals 2. Verbal response equals 2. Motor response equals 4. 19. Your patient is a 23-year-old man who complains of abdominal pain. The patient states that the pain began suddenly and was originally located only in the area around the umbilicus. Now, however, it has moved to the right lower quadrant. The patient also complains of nausea and vomiting, and he has a fever of 102 degrees Fahrenheit. Examination displays rebound tenderness. What condition should you suspect? A. Diverticulitis. B. Gastritis. C. Peptic ulcer. D. Appendicitis.
Answer: D.
Explanation: the classic signs and symptoms of appendicitis are given. A 42-year-old male complains of sudden, intense pain that is centered in his lower back. He is pale, cool, and diaphoretic, especially below the level of his umbilicus. He is tachycardic and hypoton _X0002_Civ. Which of the following conditions best describes the patient presentation? A. Myocardial infarction. B. Abdominal aortic aneurysm. C. Pancreatitis. D. Kidney stones.
Answer: B.
The abdominal aorta is located in the retro_X0002_peritoneal space. A sudden loss of pressure due to an aortic aneurysm will result in loss of perfusion below the site of injury.